I'm Barbara Abernathy. I'm an MPN patient. I am a therapist who works with cancer patients. I'm CEO of the Pediatric Oncology Support Team. And I'm an advocate for people with MPNs. The Pediatric Oncology Support Team is a nonprofit that helps local children and their families fight cancer by giving them the emotional and financial support that they need. I was diagnosed with polycythemia vera in 1996. My doctor said to me, well, your grandmother was in her 70s when she got leukemia and she died, and your father was in his 50s when he got leukemia and he died. You're in your 30s, so you do the math. And I thought, that's not going to be my story. Back in the late 90s, when the internet was new, there were things called listservs. You would post a question and somebody would respond to a question, but it was a way of connecting with other people with your illness. In working with the Leukemia and Lymphoma Society over time, they said, you should probably talk to other patients and maybe you can inspire them with your story. When you have a rare disease, a rare cancer, it's super hard because other people can't relate. Other people don't have any experience with it. Finding other people who are struggling with the same thing and having the same questions I can't overstate the importance of what that feels like. It soothes your soul to really find people who are traveling this lonely road with you. My patients teach me so much more than I could ever teach them. What I learn from them is that I'm more than my disease. I am more than what happens to me. I'm more than a diagnosis, and that I have to keep living my life. Helping people one-on-one is super important, but we also need to make an impact at a national policy level. Rule out leukemia. So I got on board quite early with the Leukemia and Lymphoma Society's Oral Parity Advocacy Initiative. I think it's super important for all of us who are impacted by illness to get involved in the national debate about healthcare, because who has more of a stake in it than somebody who's walking and living it every day? Our voices need to be heard. My entire life was shaped by my diagnosis. If I was only going to be here for a short time, I needed to leave my mark. I needed to leave an imprint behind. I needed to make a difference, because you want people to know that you were here and that you mattered. And so now my legacy is I am here and I do matter, and I get to offer that to other people, and I get to give that to other patients, and I get to let them know how important it is to fight and how important it is to keep going and to keep living your life and to keep hoping and to keep dreaming and to keep planning for what the next phase is.